Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
40% of adults and 20% of children are obese, and these percentages are rising. By 2030, researchers project that obesity will affect nearly half of U.S. adults. Obesity is associated with a higher risk of 13 types of cancer, as well as poor survival rates for several types of cancer in the next 15 years. It is expected that obesity will overtake tobacco as the leading cause of cancer during this time. Losing excess weight can be a daunting challenge. Few healthcare professionals receive comprehensive training in how to effectively help their patients who are obese. In our research, the goal is to develop and test individual and community-based behavioral interventions that not only help people achieve the difficult goal of losing weight, but also sustain that loss over time. Good morning. I'm Dr. Roy Jensen, Director of the University of Kansas Cancer Center, and with me this morning is Dr. Christy Beffert, Associate Director for Cancer Prevention and Control in a Population Health Research. Joining us via Skype is a physician by the name of Dr. Jennifer McKinnon, based in Fredonia, Kansas, and Les Lacey, based out of St. Francis, Kansas. So all of you recently worked together in a 5-year-long patient-centered outcomes research institute research study evaluating effective weight loss strategies. Can you tell us a little bit more about that study, Dr. Beffert?
Yes, so this was a clinical trial that we conducted in the rural Midwest, and we were really interested in trying to bridge the research to practice gap that exists for obesity, which is pretty big. It's a pretty big gap, and it's kind of a shame given that it's our #1 chronic disease in the country. And so we were really interested in looking at different ways of implementing treatment into primary care settings. So folks may know that Medicare passed a provision back in 2012 that covered obesity, behavioral obesity treatment for the first time, and nobody was using it. Less than 1% were actually using the benefit. And it was based on our traditional model of 15-minute office visits. You go to your doctor and you get 15 minutes and then you're on your way. And so we wanted to compare alternatives to that model that were more patient-centered, had better access, involved group treatment. And so that's really what the study was about. And so we had 36 clinics throughout the Midwest that participated. They were randomized to these different approaches, had about over 1,400 patients enroll, and looked at how they were able to accomplish weight loss over 2 years.
So that study was called Repower, and my next question is to Dr. McKinnon. Why did you become involved in Repower?
Well, I became involved with Repower because I was noticing that I had more and more patients that came to me for advice on how to lose weight, seeking medical treatments, surgical treatments, all of these things. And I know in our busy practice as a family physician, we have about 15 minutes with each person, and that definitely doesn't allow enough time to be able to properly coach somebody on how to lose weight, and we don't have the follow-up, every week or as much as they need to be able to properly do that. So realizing that over half of my adult patients in my practice are in that overweight or obese category, this was something that really was clinically relevant for our practice. And of course, it was presented by my former faculty members and now colleagues, being a proud graduate of KU Med. When they come to me with ideas that I can bring back to my practice in Fredonia, I always want to jump on board. And so talking with them and then being a part of the K-Pepper board, it was really something that I wanted to bring to our rural community to be able to improve the care of my patients in a way that we hadn't done before.
That's fantastic. So, same question for you, Les. What motivated you to become a patient advisor in the Repower project?
Well, I'm a nurse by training, and so I'm into helping others. And so this is part of helping others by identifying those that want to help us and then helping them to help us. The other thing is this is my personal challenge, and I've been fighting it for 40 years. It's kind of a desperate thing, and it's desperate enough that I liken it to somewhat of a knife fight, even though I've never been in a knife fight and don't ever want to be in a knife fight. But it's a point that we have to pick up every day and be very, very focused on. And in addition, I understand the personal costs of not winning this battle quickly. All those things are important to me. It seems that the best success is when you are able to have somebody that has your back and you have a coach that understands.
Absolutely. So, Dr. Beffert, how did you come to design this trial, and what really inspired you to launch the Repower effort?
Well, it was a lot of things. One of them was that we had this, for the first time you could bill to treat obesity in primary care, and nobody was using it. So that's calling for somebody to come in and try to figure out why. But I think the other thing, one thing I didn't mention was that the study was designed specifically for rural primary care, where you have more people that are having consequences of this and less things available to help them. And I really see the value in rural family medicine for stepping up to really help with this. And that sense has only grown through the process of doing it and trying to bridge what I hear from the patient side and what I hear from the provider side, which is kind of this little stickiness and, in terms of people not knowing quite what to do to kind of come together and tackle this together. That's exciting to me, and I'm kind of a third party out on the outside watching that, and to be able to contribute to that in a scientific way is fun and exciting.
Yeah, that's fantastic. So if you're just joining us, we're here with Dr. Christy Beffert, Dr. Jennifer McKinnon, and Les Lacey talking about Repower, a 5-year study that they were involved in that evaluated different weight loss strategies. Remember to share this link with people you think might benefit from our discussion. So, Dr. Beffert, just could you summarize for us what are the key findings of the Repower study, and how do you think this is going to influence our approach to weight loss interventions?
So one of the early things that we found, and I think this is really important because a lot of times and Dr. McKinnon can speak to this, but a lot of times providers kind of feel that stickiness about not knowing how to approach the subject and not knowing, if patients are interested or motivated in taking the steps that they need to take to address the issue. And one of the things that we found that I think is important for providers to know is that about 1 out of 7 or 8 patients at any point in time appear to be ready to do this. If you talk to them about it, and they're not just relying on advertisements in the clinic or through the mail, if you actually talk to them about it, it seems to be like 1 out of 4 or 1 out of 5 are gonna take you up on an offer if you have a plan to give them. So that's an important finding, because a big issue in this whole space is that the subject's not being raised out of these fears. In terms of what we found with weight loss in the study over 2 years for each patient, I can't share the exact findings because they're still under peer review in the scientific literature. But I will say that all of the approaches worked in helping a large percentage of patients achieve a clinically meaningful weight loss. And one of the more surprising findings that we had was that patients and providers really saw the benefits of offering this service actually in-house in the local clinics, as opposed to trying to do it remotely.
All right. So obviously that leads back to you, Dr. McKinnon. From your perspective as a community physician, what did you learn from this project?
I learned that we do have a lot of patients out there that are interested in weight loss, just like Christy said, and sometimes it is awkward to bring up the topic for both the patient and for the provider. And so this did allow us a way to talk about this safely with our patients and find people, and they were not hard to find, people who are interested in working on weight loss. And so I realized through this that I need to be able to bring up this subject more often, just because it's the right thing to do for my patients, just like we do with smoking and substance abuse and everything else. Another thing that I learned is that we can actually use our entire clinic team to help do this. So, you know, as providers, we oftentimes are trying to do things all by ourselves. I have 15 minutes to talk to you about weight loss. Let's get this done. And then you come back, you know, a month or 3 months later, and I expect you to lose lots of weight. But that's obviously not how it works. And so having the rest of the team in the clinic be able to call and check on patients or actually do visits with patients in between our visits, that was really, really helpful. And then just knowing that that we can do this, and in a private practice like mine, I have to be able to sustain the practice, keep the doors open. And so we can bill for services like this too, and that's an important part just in the practice management of our practice. So lots of things that we learned by doing this.
Mm-hmm. So Les, something I want to explore with you is that you and a number of your other patient advisory council members authored a really powerful essay about, you know, the feelings, the dread, the anxiety that some patients have when talking to their doctor about their health, and specifically obesity. Could you tell us about what your observations were from that essay?
Well, the group of patient advisors really got to be friends. And so that really kind of set the stage for our conversation. And what we had was passionate at times. It was insightful. It was thoughtful. It was very personal and frank. And you know, we got down and were discussing this thing. And I'm really grateful for Christy's guidance and her team's guidance to keep us on track to be able to answer the question that we had in mind. You know, we learned that a lot of us had the same kind of experience, and a lot of us had a different experience. And at the same time, there was a common theme that fed through all of it. And some of that dealt with the desperation to find something that worked and the need to trust somebody as we went through that.
It's a great conclusion. So we're approaching the end of today's episode, and I'd like to hear from each of you. What advice do you have for someone who is overweight and looking for a change? And I'm just asking for a friend.
You're okay, just a friend. I'm not going to get into the specifics. I really want to answer that question big picture because I think that's what's important. And I've learned this from my research, but even more so from talking to people like Les, which is it's a long game. It's a really long game. It's a hard game. And the chances of you winning it alone are probably not too good. So keep that in mind. Find a person who's going to help you. Don't be afraid to talk to your provider. If that provider's not getting it, find somebody else who may. But don't try to do it alone. There's a lot of different things out there that can work, but the key is really keeping it up.
Great advice. Dr. McKinney.
Sure. I would tell anybody trying to lose weight and become healthier to come and talk to us. Talk to your doctor, talk to your provider, talk to anybody, because we do want to help. We want to help you as much as we want to help with diabetes and hypertension. It's just as important. So don't be scared. Please bring it up. We want to do what's best for your health.
And Les, we're going to give you the last word on this.
Okay. Well, I think the first thing is to stay in the fight and stay focused. It's about choices that you make on a minute by minute, hour by hour, and day by day basis. So you have to stay focused. You need to measure your results, and you need to clearly understand your motivation. And in addition, you're going to need to find a teammate and a coach. So the teammate has your back, and that coach helps you with the plan and helps keep you accountable to your tracking. And it is a long fight.
Well, that's another great piece of advice. And Dr. Beffert, Dr. McKinney, and Les, thank you for being part of this week's episode of Bench to Bedside. That's it for today. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.